are back with Christie Leath-Warren, nurse practitioner with Cone Health Urgent Care in Reidsville, talking about all kinds of spring health. So this next one is something that we talk about a lot in the summertime, and that is hydration. We, talk about it, when it's so hot out and that kind of stuff. But hydration is something that we need to be thinking about all year long.
Absolutely, absolutely. So the biggest thing is you need to, like you said, drink year round. Most of us don't start drinking until we get thirsty. You need to start drinking and hydrating well before then. If you're doing anything strenuous, you need to hydrate before, after, and during the activity. And then also, if you're doing something strenuous outside and you're at higher risk for dehydration, adding an electrolyte replenishment may also be helpful.
All right, are there certain warning signs of dehydration that maybe people don't think about that they should be aware of?
Yeah, so first thing you may notice is dark colored urine or tea colored urine. Also, you may have some more fatigue, dizziness, headache. You may have some minor muscle cramps or minor cramps to your body. And you're like, where's that coming from? The biggest red flag that we try to be aware of is definitely any new onset confusion. The person stops sweating, they have rapid heart rate, or they're feeling faint or like they're going to pass out. Those are really big red flags where you want to get somewhere and be seen quickly.
Gotcha. Okay. Now let's talk about how spring can trigger asthma. I know we already talked about allergies, but this is asthma and other breathing problems. How can people stay ahead of having any flare-ups?
So normally most patients that have asthma, they may also have a coexisting allergy condition as well. So definitely just being aware of your triggers. So certain triggers for asthma or pollen or a sudden change in the weather. So just being aware of that. Also keeping an inhaler, a rescue inhaler, if you need that in case you get in trouble and you need quick recovery. But a lot of patients as well that have asthma may be on maintenance medications. So make sure you never run out of your asthma medications. Definitely, if you know that cold weather or pollen is a trigger, again, you want to stay away from those triggers because those are the things that most often cause your asthma to flare.
All right, and I think to myself, we work in offices with people who may have things that we don't know. So what are some signs that maybe we would need to contact a healthcare provider on their behalf, or what would they contact a healthcare provider for with the asthma issues?
Yes, so if you're sitting next to someone and you hear something called wheezing or like a whistling when they're breathing, that's usually a very common sign of an asthma flare. If they're coughing a lot, some people don't think about coughing as a condition or a symptom of an asthma exacerbation or flare. And also, if you see someone that's struggling to talk or can't talk in a complete sentence, that is an immediate emergency. That's an immediate trip to the emergency department. And also, just looking at their lips or their fingernail beds, if they're discolored or dark or dusky, is what we call it, that's another red flag symptom for an asthma exacerbation. And these things can go bad very quickly.
Yeah. I know, we're all happy to have the warmer weather and seeing the sunshine and that kind of thing, but that also means that the mosquitoes and the ticks and those kinds of things return. Remind us about some steps to prevent those threats.
Of course, first and foremost, you just protect yourself. Wear long sleeves, long pants. I know we don't still want to do that, or socks, especially if you're going to be out in the woods. Any kind of tick or insect repellent is also helpful. And then also make sure when you go outside and you come back inside that you're checking your body for ticks. A lot of people find them after the fact, and that really causes a big concern, on a patient's side. So make sure you're checking your body well or having someone check after you come from outside as well.
Yeah, and those pets, of course, can have ticks on them too. You got to check them and be doing all that kind of stuff. All right, we got about a minute left or so. Final thoughts on these springtime injuries or ailments that people aren't thinking of?
Yes, just be prepared, be ready. Like I said, take your allergy medication daily. Just reiterating what we talked about. Drink a lot of fluids. Be prepared. Protect your skin. Protect your arms, your legs. You want to do repellents, and also make sure you're definitely aware of your surroundings and knowing when to seek help.
All right. Thank you for your expertise and your time today. If you missed any of this, maybe you need to send it to someone. It's going to be in the To Your Well-Being section of our website.